everybody can hear me. Doesn't matter if you can't see me, you're not missing anything. So, welcome to the first virtual meeting of the year itself.
Chair, I'm sorry to interrupt. Your audio is not working.
Oh, isn't it? Can everybody else hear me?
No.
It's sort of cutting in and out, so partly.
Not very well,
Right,
Nick. No.
Okay, bear with me. I'm going to mute my screen then, video screen for the moment. So hopefully that will help. Here we go. Again. Here we go. Can I ask everybody else to mute their microphones and their video cameras?
Everyone could take off the video camera. That might help.
Yeah, should help with bandwidth. Right, so the proceedings are being held live on the internet and the meeting is being recorded. This will assist the conduct of business if participants speak when invited. Members of the public are welcome to view proceedings, but they should not make contributions to the meeting. Anyone wishing to speak should indicate by using the raise hand button on Teams, which you'll see at the bottom of the toolbar going across, and I'll invite people to speak at the appropriate time. As for everyone's patience with this technology as well, including my own patience as well, because I know how wonderful it can be when it works. And finally, the documents for this meeting have already been circulated in advance, and so can I ask that the presenters keep things relatively brief, and where possible can they share them on screen. So hopefully this will actually keep things to a tight time scale. So now I've got that out of the way. Have we got any apologies for absence for this afternoon?
Yes, Chair. From Paul Davis, Paul Malbeck, Dr. Ruth Edwards and Helen Ellis.
Thank you, Lisa. And do we have any substitute members serving for this meeting?
Not for elected members, Chair, but Marcia Foster is substituting for Mark Axel, Chair.
Oh, thank you. Welcome to you, Marcia, this afternoon.
Afternoon. Thank you, Chair. Thank you.
Thank you. And to confirm and sign the minutes of the meeting on the 4th of December 2019 as a correct record. Are members happy for me to eventually sign those minutes off?
Yes.
Thank you very much. Lisa, I'll get those signed at some point when I'm in the council house.
Thank you, Chair.
Right. So again, welcome to this meeting. It's been quite a turbulent few months with the pandemic situation that we've all been heavily involved with, and we've seen in the press and we've experienced locally many people suffer from the virus, and sadly so many people actually losing their lives to it. And we've also seen a huge amount of support from carers, care professionals, volunteers, right across the board. And I think if we can, just for this moment, if we can take a minute's silence to acknowledge those that have lost their lives, and also as we give a message of thanks to those that have taken part. So if we can have a minute's silence, please. Thank you. Thank you all. Thank you. Right, going back to the agenda now, to agenda item 6, and that is the election of vice chair. As some of you know, David Higgerty is stood down from this role for personal reasons. And so we are now looking to elect vice chair. Please, have received any nominations?
Sorry, Chair, I did lose a bit of your conversation there. I think Karen Jackson was going to talk about this issue.
Thank you.
Yes.
Thank you,
Yes,
Karen.
that's fine. I was going to suggest we defer it, if that's okay, till the next meeting, so that we can start to approach and identify some nominees, if that's okay. Unless, of course, there's anybody has got a burning desire to put themselves forward this afternoon.
Thank you, Karen. Is anybody brave enough to put their name forward, or shall we, as Karen suggests, defer this item for the next meeting?
It looks like it's deferred.
It is indeed. Okay.
Okay.
Lovely. Thank you very much. That's noted. Right. Moving on to business of the day now, and to agenda item 7, and we're looking at updates from the current strategic priorities, the impact, and also post-COVID as well, because I think it's important that we utilise the health and well-being as much as possible. So I'm going to hand over to Karen, who's going to look at the mitigating the impact of poverty. We've lost Karen.
Can you hear me now?
Yes, Karen. Yeah.
Okay, thanks. Yes, we've prepared a flash report on the mitigating the impact of poverty, which I'm hoping you've all had a chance to have a read of. If I could just pull out 1 or 2 key points. Firstly, just as a reminder that before COVID, we were working to develop a whole systems plan to mitigate the impact of poverty, and we were halfway through that process when COVID happened. So we'd had the first workshop and identified the causes, which had gone really well, and the second workshop was planned for April, and that would have developed the sort of the system-wide actions that we wanted to focus on. There'd also been some work done with residents looking at insights and experiences of living in poverty, and that video's ready, but again it was due to be shown at the workshop, so that's the position we were in at the time. As the emergency happened, there was a number. Our plans changed really, and the focus shifted to putting in place emergency measures to help mitigate the impact of poverty. And there's a number of examples detailed in the report under the something to celebrate and to share. Obviously, sort of going forward in terms of concerns, poverty is going to be poverty and inequalities are going to be a key, still going to have a huge impact and be further exacerbated by the pandemic and the lockdown. So there'll be more people struggling. So this remains a key area and a key priority for the system. So we do want to continue and to get the work in place. So the next steps really now are to try and re-establish the whole systems work, and to refresh the data that we have, and also to continue with the emergency measures that have currently been put in place over the next few months. And we'll be looking to partners really to support this work going forward, and to sort of contribute and to identify the contributions that they can make in order to mitigate poverty. So that's currently where we are. I don't know if anybody's got any questions.
Thank you, Karen. I can't see anybody raising their hand. Please? No? No, I mean, certainly. Oh, Sue, Councillor Ridney.
I obviously, same as the meeting yesterday, my concerns are that we have not yet come to the end of this pandemic, and we cannot yet identify all the families and the children in particular, in my case, to say that will have fallen into this bracket. Probably ones that weren't there prior to the crisis but are there now. So I think we actually have some ground to make up with this, and I think we will probably find that it's a different picture now to what it was prior to the pandemic.
Councillor Buttery.
Thank you, Chair. Yeah, I want to echo what Sue was saying, Councillor Ridney was saying, around the fact that this is now going to be a different picture. I'm not saying you have to rip up that report and start again, but I know the numbers of children who are now on free school meals has risen quite exponentially through this time, because obviously as soon as you go onto universal credit, the child then is eligible for free school meals. So I think a suggestion would be that you work obviously through the children's team to identify all the children who are now on free school meals who weren't before, because that's a ready data, ready accessible information of probably families who are going to be struggling, and it might be worth having a sort of almost like a previously on free school meals and now new to the free school meal list, because those two different brackets of families might need different support and different help. That would be my suggestion, I think, listening to this report.
Okay, thank you.
Thank you. Yes, I mean, it's absolutely. Kath.
Come off mute. Thank you, Chair. Just to sort of echo a little bit what Councillor Buttery and Councillor Ridney said there. There is a strong indication that we've got a lot of what's known as hidden harm out there. So young people that we don't know about, that because of the lockdown and because they've not met the government criteria for being in school, either they've hit the year groups or they've hit the vulnerable, because they've got social support, a key worker young child, that we are anticipating, and the DfE are asking us to gear up for a significant number of children coming to our attention, many of whom are sort of in that hidden harm bracket and potentially have hit the bedline threshold as well, which may have not been because of COVID. So I would support really that there is a lot of unknown out there that we're gearing up to thinking that might just impact on child well-being, poverty and those sort of things. So just I think it's a watching brief, if I'm honest with you, Chair.
No, absolutely. I take your points on board, Kath. Thank you, Councillor Buttery and Ridney, for your comments as well. I think when we look at the increase in food bank usage and also the number of support parcels that voluntary groups have been sending out, I think that speaks volumes from this. Karen, is there anything else that you want to come in with on that?
No, that's really helpful comments. Thank you. And yes, I agree. It is going to be a different picture out there, and there's going to be a lot more people caught in that situation as a result. So yes.
Lovely. Thank you very much, Karen. And certainly it's going to be one we're going to watch with great interest, I think, as we come out of this coronavirus. When that will be, I just do not know. But you know, we've certainly got to keep on our wits with this. Right. Thank you. So that is noted. We move on to the next report, and that is Liz. You're presenting on the healthy weight goal update.
Okay, thank you, Chair. There's myself and my colleague Bal Johal presenting to you. So again, you should have seen the report, the flashcard report that we sent forward. The highlights from the report are that we had 4 groups of residents who met 7 times between September and November last year, 56 regular attendees who looked at the question, what can we all do together to help people in the Dudley Borough be healthy? The groups each identified key issues and met with commentators or experts who provided them with information about their priority issues. 18 group members had a further 340 conversations with members of their communities, and with that information the groups gathered, they put forward a list of 10 themes with recommendations at a launch event in December. At the launch event, organisations and community members worked together to action plan how these recommendations would be carried forward. And what we were going to ask the board in March was for a commitment to ensure that the delivery of the actions identified happened. One of the major risks was that momentum would stop and the actions wouldn't be carried out. And the main threat with that would be, again, that the community would lose trust in what we've done and worked so hard to achieve. Unfortunately, due to the pandemic, some of the momentum has been lost. And in the current climate, some of the work has had to be put on hold. So some actions and recommendations we envisage will need to be adapted as life evolves and new challenges are created by COVID. What we do have is a really good base with the community health action meetings and the people that we worked with, and good communication between the services and the public. So that should give us a really good base to build upon when we go into our recovery. So what we're looking for really is the commitment from the Health and Wellbeing Board to ensure the delivery of the actions identified of those 10 priority issues, taking and breaking down any barriers that there may. Thank you.
Thank you, Liz. Has anybody got wish to make a comment on that? I think certainly from my perspective, I think, you know, we cannot lose sight of this, especially with COVID. I know that Councillor Buttering and I mentioned this in a conversation earlier about obesity, and you know, it is on the rise because of this. A lot of people leading a more sedentary lifestyle than they probably would have in shall we say, peacetime, in normal situations. So I think, you know, we cannot lose sight of this. Again, it's another very important area that we need to keep active, excuse the pun, we need to keep moving with this. And yes, the community, the action group, I know were very supportive, you know, very engaging, and I think we need to continue to make sure that moves on again at a pace. I've got 3 hands showing. Bal Johal, did you want to come in? No, your hands just disappeared.
Hi, thanks. Thank you, Chair. It was just to follow up on what Liz said in terms of our ask of the Health and Wellbeing Board. It was just going to be to, I suppose, allocate responsibility for taking the 10 different thematic areas that were highlighted forward. And what I was going to propose that we do is that we were going to share the document that has all of the actions on there, grouped by their theme areas. And also we were going to put our suggestion of where the responsibility for making sure that those actions happened would lie, in terms of which sort of department or sort of strategic group would be responsible for that. Not the delivery, but just ensuring that the momentum is kept up, and the people who are been assigned specific tasks deliver on those. And so yeah, the proposal was that we share that document with all the members of the Health and Wellbeing Board, and ask for any feedback if they disagree with the areas that we've assigned to be fed back to us in a fortnight or so, if that was okay.
Yes, I'm happy with that. I'm sure that other members will be. I've got Councillor Buttery and then Sue Haywood.
Thank you, Chair. Yeah, just to echo what we were chatting about earlier, and I'm sure all my health colleagues will be aware of this, that the sort of the more severely affected by COVID are, obviously we have the BME community, but actually the severely obese were very badly affected by this. Obviously, I mean, it makes complete sense with the adipose tissue and the extra stress on your respiratory and cardiac systems, and I just think it's good that we've got this report. However, we need some sort of timeline, and we need to see some really clear actions. I mean, I know we spoke in the past about using the leisure centres, whether we do that indoors or outdoors, to have health colleagues in there as well as leisure centre staff. You know, we really need to go at this at pace, and it's a great report, but it's that timeliness around it. It's sort of, because otherwise there will be quite, you know, it's very easy for these things to drift and for delay to come in, as we know. And I think given the great holistic work that we've seen across the council during this time has been really, really positive, and I think it'd be good to sort of harness that energy. I know in some ways we're all tired from this, but harness the energy to try and move this forward at pace, because should we get either this coming back or another pandemic in the future, you know, 80% of new viruses in the last 10 years have come out of China. You know, we've already had SARS and MERS previously, which didn't affect us so badly, but have other countries. You know, if we don't get our population in a much better position, it will be, you know, we won't be in a good, you know, as a nation, it won't be a good position for us to be in. So I think we can only do what we can do in Dudley, but I think this does need to be moved, you know, at quite a decent pace. Thank you, Chair.
Thank you, Councillor Buttery. No, I completely agree. I think, you know, when we look at these three priorities, they are absolutely time critical, and they link in so much to what is going on at the moment. So I think, you know, we do have to keep these moving very swiftly, you know, to help us deal with the pandemic and how we come out of it. So I'll completely take your point on board. I've got no other going. Please, Val, if you want to come back in on that.
Sorry, I didn't catch that last bit. I think that was addressed to me, Chair. Can you just repeat that?
No, I was just saying, I think, you know, that these three, you know, three priorities are quite critical at the moment, you know, that they link, you know, very much into the, you know, what we're facing at the, you know, at this particular time. So no, there's just a general observation on that. So I'm not sure if you wanted to come back in on what Councillor Buttery has mentioned earlier.
Yeah, just to say, Councillor Buttery, that yeah, we've I think when we circulate the list of actions, that that you'll see that they do go into a sort of quite an operational level in terms of things that will hopefully result in sort of tangible action on the ground. So when we share that, hopefully you'll pick up the sense of that within that document, and leisure was one of the themes in terms of the specific example that you gave as well. So yeah, hopefully when we share that document after this meeting, that'll become a bit clearer.
Yes, I think we'll probably end up doing some surveys. I think, going, how people have felt, with how they've handled the virus and what impact they think that it's going to have on themselves. So I think, there's certainly a lot of work that needs to go beyond this. So thank you both very much indeed for that report. But yes, we look forward to receiving further information from you, and we'll certainly make sure that's returned quickly. Moving on to the next one, and that is loneliness and isolation. I think that is the thing, if you are in the room.
Hi, Chair. It's Mayada. Lee is
Oh,
not
hi,
working
Mayada.
today. Hi. So I'll assume you read the flash report. It highlighted a number of progress in the area of reducing loneliness and isolation. So I'm just going to pick on just a few of them and then discuss the future direction and what support we need from the Health and Wellbeing Board. Before we go in, we went into the lockdown. We had the participatory budget, which is we mainly focused on reducing loneliness and isolation, and it's about community groups bidding for a small amount of money for projects. So 17 projects were successful, and we started funding 11 of those. And then the lockdown came, but the team responsible kept in touch with those groups and supported them through social media. And I think once we are out of lockdown and once it's safe, they will hit the ground running. Also, before the lockdown, the Helzoin Business Investment District, they won a bid, and it's co-funded by the local authority as well to develop a friendly bench in the town center. The bench, I think, was supposed to be put on in July, but we've delayed that as well. The other update is a Good Neighborhood Scheme, which is a befriending scheme, and it's currently or used to be delivered by Age UK. But Age UK, Dudley, as you know, it's closing down. So we took the coordination of that project inside public health until we pass it to another provider. The plan is for it to be incorporated into the one voluntary contract, but because of the delay in that, so we are keen not to have gap in that service. One of the other thing is the Please to Meet You service. Now they extended their hours and they extended their age cover. So as you might, I'm sure you will agree with me, COVID has highlighted the impact of loneliness and isolation, not only on lonely people, but on all of us, really. So, and I think one of the things is it increased the use of social media and increased the use of the internet. So what we as a currently, the work on loneliness and isolation is done into subgroups, but now we had a meeting and we decided we thought that we needed to come together in a network, in a wider network, including all the community groups and all representation from communities to understand what we learned from COVID in terms of the impact on loneliness and isolation, and how could we capitalize on that learning, positive and negative, and develop or build on the services we developed to reduce loneliness and isolation. The management of that network is going to be shared between adult social care and health and well-being division. So what we require from or our ask from the board is to support that network approach, support the approach of the need to learn from COVID in terms of the positives, especially utilization of social media and the internet, the negative and how it impacted negatively on the population, all sectors of the population. It's not only older people, and also in marketing existing tools we have, like the Dudley CI and the loneliness and isolation training toolkit we've developed. Thank you very much, Chair.
Thank you, Mayada. I think, we've seen so much work that's been done with initiatives such as the Pleased to Meet You service that's gone from strength to strength. And, we've seen so many cases of people being isolated in their homes, whether it's because of age or whether they've got underlying health conditions, which means that they've been stuck at home. If they've been used to, dealing with support networks, we've got so many excellent organisations that have been out there. It's been a great help. But when those, sort of fallen through the cracks for whatever reasons, I think, it is important we continue to support those as best as possible. Social media is wonderful, and it's really come to the fore, I think, at this time, in making sure that we get as much information out there as possible that we share. I think we have to be very mindful, though, that there are individuals that aren't on the internet or don't have access to the internet. So we need to ensure that any information is shared out there through whatever means possible. And I know that we have put, the Home magazine out, and we've put a lot of other information out in the local press as well. And I think, we have to utilise, the good old-fashioned hard copy as well, to make sure we continue to get those stories out and make sure that people are, fully aware of the support that is available, especially at the time when our libraries are currently closed. So I think the sooner they're able to open, again, that will help. Sorry, has anybody got any? Shelley. Afternoon, Shelley.
Yes, hi, Councillor. Saying on that point, really, probably more than ever, we've actually managed to get the messages out via during COVID in relation to the schemes that we have got on offer that Mayada has alluded to. So we produced 50,000 booklets to the vulnerable cohort of our population and also older people, and that went and was distributed pharmacies and indeed also all the supermarkets. So obviously clearly some people were not attending those supermarkets, but certainly they have family and information up as well. In addition, we had Black Country Radio campaign and paid for digital online presence as well, and we've had a huge response to that online campaign. And we've exceeded what would be classed as an industry standard in terms of digital. So we're quite pleased that we've managed to get information out. Obviously, it's not just around isolation and loneliness, but obviously we've included that in that information to that cohort of the population in Dudley. Thank you.
Thank you, Shelley. I'm really pleased that you're on the line and highlighting the fantastic work that our communications and marketing team have done. I think, you've all done an exceptional job in getting that information out, and extremely swiftly, I have to say, especially the number of press releases that we've been issuing and the stories. So thank you very much, and please pass on my thanks to the rest of the comms team for what they've done.
I will do, thank you.
Thank you, Shelley. Kath.
Come off mute again. Thank you, Chair. Yeah, it's very similar to the the previous discussion around the hidden harm. And I note in the report it makes reference to surveys for years 8 and school young people in year 11. And for me, there'll be something around September and whatever that may look like when the schools return. And at the moment, there's a drive that they will all just come back. In that, I think we there's a higher risk of us having a number of children not going back into school and being electively home education, school refusers, and a part of that is around the fact that they felt isolated, lonely and scared, and therefore have sort of, you know, that hidden harm of what the impacts of COVID has. And I think that might be something, maybe more surveys with younger people around how they're feeling and coming out of this and coming back into society, as it were. I mean, Councillor Buttery and I have talked around, we've almost like drove a coach and horses through socialisation. We're suddenly saying to young people, you can't share, you can't go near one another, you know, and drove them into their bedrooms with some of them. You know, we've took all the social sports and, like you said, the libraries and things. So I think there's again the potential hidden harm there around that's linked to that from social isolation, that I think maybe another survey would benefit maybe around September time with them young people.
No, I absolutely agree, Kath. Thank you, Kath. No, I completely, you know, accept that. I think, you know, that you know, we tend to think of loneliness and isolation for our older population, but you know, it's affected so many people right across the, you know, the age spectrum, and you know, it's completely alien to our young people. The fact that, you know, they're used to having you know, that interaction with people out there, and that, you know, they're having to rely solely on you know, on their smartphones and goodness knows what, probably at a time when parents are telling them to get off them. You know, it's sort of throwing you know, the norm completely out the window. So no, I think, you know, we need to engage with our young people as much as we do with our older people, and certainly, you know, when, you know, they do eventually go back to school and college, that we need to have some sort of engagement exercise, you know, with them. And I know that, you know, we touched on this yesterday in another meeting, so I know completely accept those points. Councillor Buttery. Thank you, Kath. Over to you, Ruth.
Yes, so yeah, just to echo what Kath's been saying, I think also we've got a concern around, obviously there's still the unknown, and children don't thrive well in uncertainty. We don't know what September's going to look like, and obviously as a children's team, well, across the council, we're trying to put in some summer provision to get, more than anything, to get the children back into a normal routine, so they're used to coming to school. Because I think it'd probably be good to have, I don't know what Councillor Ridney and Kath and yourself think as well, but it's good to have on the agenda sort of how the young people do over the summer. Sorry, that's my daughter on Mario Kart currently. How the young people do through the summer, but also how many NEETs we end up with in September. Because I think for us, through the summer, it's not so much about them learning maths and English, but just getting back into a routine, getting up in the morning, doing something positive with their day, and then coming home again, so that September won't be such a big issue. But there are lots and lots of challenges around this. So I think, again, as we said with the previous issue around harm, I think this is a watching brief as this unfolds through the summer, and as it unfolds through September as well. You know, what are our young people doing? What are the ones who should be going to college, who should be doing apprenticeships, who should be doing university, going to university? You know, I don't want to lose that generation. So it's really important, I think, that we keep it on the agenda, and just to keep to see and how as a borough we can support these young people to become more resilient through this. Because I think if they've got through this time, you know, in some ways you could say, well, if you've got through this, you can get through anything, and look at the resilience and the determination that you've got, and the lessons that you've learned from this time. But there will be some children who will obviously have really struggled and not had a positive time through this, and it's how we pick those up. So, you know, I think personally I'd like to see this sort of on the agenda sort of as a recurrent theme, because I don't think the ripple effect of this is going to be huge, and potentially we won't see the full implications of it for a year or 2 years or even 5 years. Thank you, Chair.
Thank you, Councillor Buttery. No, I completely accept that, you know, we can't, you know, ignore the issues of children and our young people in all of this. Obviously, the report does address the situation of our older people, because of this is an ongoing report. But certainly, we're not going to lose sight of that, and it's certainly not something that's going to be coming off the agenda. Mayada, you want to come back in on this?
Yes. Thank you. Thanks, Kath, and thank you, Councillor Botry. And I think having the network approach will enable us to include children and loneliness agenda amongst children and work across the whole age group. Yeah.
No, thank you, Mayada. No, I think it's one of those things where partnership working really comes into play on this. We've had some excellent work that's been done so far, especially with the Living Well Feeling Safe events that have gone before us, and we look forward to getting those re-established at some point, hopefully not too distant future. Val, you've got your hand.
Yeah, just a very quick one to say, I think most partners will be aware now that we are going to commission a special COVID-19 health-related behaviour questionnaire that will go into schools in September, and it will build upon the sort of biannual questionnaire we already deliver, so it'll help us monitor what difference COVID-19 has made. And as part of that, we do actually measure their sort of their emotional health and mental well-being as well.
Thank you, Val. And I think certainly all of this, whether it's through the Health and Wellbeing Board, Health Scrutiny, or whatever, I think there's got to be, there is going to be a lot of lessons being learned from this, and how we move forward, through our health economy and through our health partners. So, huge amount of work that is ahead of us that they're still facing. So. Thank you, Mayada. Thank you for that, and thank you others for your contribution. Right, we are moving on now to agenda item 8, and we are hang on time. So it's over to Matt and Neil. And Matt, I know that you've got to leave for another meeting.
Yes, thank you, Chair. This is myself and Neil doing backing vocals, and we collectively perform under the stage name MB and the Sunshine Band, so I'm sure that Neil will lift the back end of this report. The reason the report is in front of the board today is that we have a requirement to report on all of the quarters of the Better Care Fund, and this particular report covers up to the period of the end of 31st of March this year, the period pre-COVID. And what that means is much of the data in this report bears very little meaningful resemblance to where we are right now. What it tells you, and I'm sure Diane Wake, who's on the call today, will bear this out. We had a very heavy winter indeed, and during the months of January and February, we did struggle with meeting the Better Care Fund targets in terms of discharges. That's reflected in the January and February data. We were tasked with coming together with the CCG and also with the Dudley Group and agreeing a joint plan for this financial year. We've long since done that. We've deployed that plan. Today at the Integrated Care Executive, we were focusing on the period post-September, and specifically pathway 3 beds that are described in the report and how we're going to make that work. What I would like to say, and this doesn't reflect the data that's in the report, but the period following that, is that as a system, we've worked incredibly effectively through the COVID period. We have regularly had days of 0 delayed transfers of care in recent weeks. We were able to support the hospital in the very difficult challenge they had to free up beds, and particularly ventilated bed capacity. And because of the efforts across primary care, acute care, social care, the voluntary sector and our care providers, we were able to maintain capacity at the Russell's Hall Hospital throughout, and that remains the case as of today. So local people were able to access critical care when they needed it, and there is ventilated bed stock available as we speak, should it be necessary. So the plan describes the period up to the end of last financial year. We have implemented our new arrangements for this year, and they are working effect. We'll see that in the next performance report the board receives. As well as asking Neil to add any comments, I think it's probably also worth hearing the views of Diane from the perspective of the Dudley Group. So I'll hand over to them and then back to you, Chair.
Thank you very much, Matt. Neil, thank you.
Thank you, Chair. Just to build on what Matt was saying, really, obviously the figures speak for themselves as far as they can. We have had a large degree of success in terms of the discharge process and so on. I think the main thing to bear in mind prospectively is that ultimately the Better Care Fund is about two main issues in my mind. One is preventing unnecessary admissions to hospital and to care homes, and also having an effective discharge process when people have been admitted to hospital. And there are a number of areas where we've been able to work quite effectively in terms of achieving those two objectives throughout the year, but also in particular during this challenging period. We've got a number of lessons that we've learned from the COVID period, both in terms of preventing admission and improving discharge. Some of the services that we commission from Diane's trust have worked very effectively to prevent unnecessary admissions, particularly the work from the clinical hub that's located here in Bradley Health and Social Care Centre. And our teams that manage the discharge process across the CCG, the council and Dudley Group have worked very effectively in terms of enhancing the discharge pathways. And we'll be looking to build on that work prospectively, particularly in terms of how we reset our BCF plan for the remainder of this year and our BCF plan for next year. Those are probably the main comments I'd like to make at this stage, Chair.
Thank you very much, Neil. Thank you. Diane, I've just picked up your comments. Thank you very much for those. Very much appreciated. I think this has been a truly collaborative approach. I think our adult social care teams have worked exceptionally well, and we've had the support from the hospital, and also as Pat said, that from our voluntary sector partners as well, to deal with this. It has been a truly collaborative approach to dealing with this. Hello, Diane, got you on screen there.
Hi, absolutely. I think we've always had a strong working relationship with the council, but I think during this period it's been enhanced even further. And I think we can acknowledge the seamless system working that we've had from hospital, community and social care, and it really has supported our very proactive response to COVID in terms of keeping our patients safe and making sure that we've got the right bed capacity to manage patients safely in the hospital. We did notice up until about 2 weeks ago that emergency attendances and admissions had stayed fairly low, not getting back to pre-COVID activity, but rest assured those numbers are back up and we are nearly back up to pre-COVID levels. And our bed state, which had really been quite good over the last couple of months, we are beginning to get some challenges with the number of beds that we have available. So we can see some of those attendances coming back, but I think if we continue the strong partnership working that we've got now, then we are going to be able to manage some of those difficulties. But a big thank you to everybody, not only the council but other partners who've supported the organisation, but just the general community response in the Dudley Borough. We could not have asked for more, and the support to the hospital has been incredible. So I just take this opportunity to say a massive thank you to everybody in every sector. It's really appreciated.
Thank you, Diane. Thank you for those words. It's very much appreciated. Now I think again, everybody is mucked in. They've adapted to the situation, exceptionally well. And they've just got on with it, and that's right across the whole system, whether it's from within the council or from our external partners. So from me, a huge thank you for everybody, for the efforts of everybody right across this. So the report is to note its contents and take on the reassurance Obviously, these are exceptional times, and obviously, as Matt said, the data doesn't exactly reflect, where we are at this particular moment. So we look forward to the next report at the next meeting. So Neil and Matt, thank you very much. Matt, did you want to come in again?
Yes, just quickly, Chair. The data that Greg Barbosa is about to take us through in terms of the current COVID position will fill the gap out between the end of this report and the current day. So that will help make sure the board's properly cited.
That was very good. That's and very good link into to the next agenda item. So Greg, it's over to you.
Thank you, Chair. So I'm going to share my screen briefly so you can all see the presentation. I've been asked to present the current situation on COVID in Dudley Borough, so I'm just going to run through a few slides. I put the presentation together a while ago in preparation for this meeting, so the situation has changed a little bit since then, but only in a positive way. So the first slide is showing you hopefully you can all see the slides.
Yep.
Okay, fantastic. The position of Dudley Borough and the rest of the local authorities within the West Midlands. So the chart in the middle shows Dudley roughly in the middle with a crude rate of about 279 per 100,000, which is very good if you look at all the areas above us. They tend to be the urban areas, and the majority of areas below us tend to be the more rural ones. I think the chart in the bottom right-hand corner demonstrates how well we've done compared to our Black Country partners. So again, we're the purple line right at the bottom, and our Black Country neighbours are the lines at the top, demonstrating that throughout the whole of the pandemic, we tend to have had a lower rate of infection than our neighbours. So I think that's something that everybody who's worked towards this and the community as well should be very proud of. Moving on. This is a chart showing the number of deaths that have been experienced across the Black Country, broken down by local authority, and Dudley Borough is again the purple line. I think on this chart it looks like Dudley and Wolverhampton have got fairly similar rates at various points, but if you look at the figures rather than the chart, then Dudley has the lowest number of deaths overall, which again is very good news for us, and that's continued on. The number of deaths is declining. If we have a look at the location of deaths as well, then the majority of deaths that have happened in Dudley happened fairly on in the pandemic. We had a peak around the beginning of April, and they were mainly deaths in hospital. I think after hospital, the most common location of death after that was in care homes, which is not very surprising considering the multiple vulnerabilities that people in care homes have. But if you compare our overall number of care home deaths with other similar local authorities, then again, we've had fewer outbreaks, and outbreaks have been much less severe than in many other areas of the country. In terms of care homes, in total, we've got 95 care homes across the borough. As of the 1st of April, as of 2 weeks ago, 243 residents had tested positive. I think that's probably closer to about 280 now. And there were 67 deaths within Dudley care homes at that point as well. The number has crept up very slightly since then, but again, that's much lower than our similar local authorities and our neighbours in other areas. At the peak, we had 18 care homes that had outbreaks simultaneously. At the moment, we only have one care home that is currently experiencing an outbreak, and the numbers have been pretty low in the 1s and 2s for the last 2 or 3 weeks or so. And every single resident aged 65 and over in the borough has been tested now, and are being tested on a regular basis. Just having a look at the number of deaths in hospitals, I want to emphasise with this chart that the numbers of deaths in Dudley Group and hospitals isn't the same as the number of deaths in Dudley Borough. So it could be that people from neighbouring local authorities have come to Dudley Group and have passed away there. So the numbers in this won't be directly comparable to the numbers presented earlier on the presentation. But again, this shows a similar situation to beforehand, that the peak in deaths was towards the beginning of April, and since then there's been a gradual downward trajectory. I think it's been quite a few days now since we last had a death in Dudley Group due to COVID. Moving on to the distribution of deaths across the borough, each of the black dots is a postcode and represents where one or more individuals have died within that postcode. And essentially the black dots tend to correlate more or less with the more densely populated areas of the borough. So there's no overall pattern here. I don't think there's any one area of the borough that has been hit massively more than another based on the data presented here. The different colours in the background, the reds and whites, are the deprivation levels within the areas. So you can see Dudley, the central areas of Dudley, where you've got more deprivation, haven't been hit that much harder than the more affluent areas towards the west and south of the borough. This chart looks at deaths by ward rather than just looking at the individual postcodes. And here you can see there are a few areas which are darker red colours, which indicate that there's a higher rate of deaths in those areas. These areas correspond to where we've had more deaths in care homes. And if we take care homes off this map, then the underlying numbers of deaths across the borough tend to be fairly even, and there's no significant difference between any of the wards. Even with the care home deaths included in this, the level of variation is relatively low, and the different colours are just to emphasise that there is some variation. If you were to apply any statistical test to this, then there wouldn't be any significant difference between the best and the worst wards. Moving on, this is an app that we've been collecting data on throughout the pandemic, which was heavily promoted by the local comms team at the start of the pandemic. And essentially it allows people within the community to say whether or not they've got symptoms. And we've been downloading data on Dudley residents and on residents for the rest of the Black Country and Birmingham throughout the pandemic to try and understand when we might hit a spike. So since the onset of the app, really, the trajectory even for all the local authorities has been very good and has been downwards. And right now we're probably at the lowest point that we've been throughout the pandemic. So what we're hoping to see is if we do start to get a second wave, like has been seen in Leicester over the last few days, that this will alert us before people start going to hospitals or we start having any major outbreaks in various places. So we're continuing to keep a very close eye on this. And the final slide, which I'm afraid wasn't included in the original slide set, is data on the Pillar 1 and Pillar 2 testing. So Pillar 1 testing is all the NHS labs that are currently testing COVID samples, and Pillar 2 testing is all the commercial and academic labs, which are now also undertaking screening. So what this shows is that the overall number of screens hit a peak towards the beginning of April, the end of March, and since then there's been quite a downwards trajectory. But also there's been a shift from NHS labs doing the majority of testing to commercial and academic labs doing the majority of testing. So hopefully we'll continue to see the number of positive tests continue to decrease. What I should also point out is that the number of tests overall is increasing because testing is more widely available than it was at the beginning of April, when it was mainly reserved for hospital trusts and people entering hospital. So the fact that we've got such a small number of positive cases from an increasing number of tests is a very good sign. So that's the presentation. I don't know if anybody's got any questions.
Thank you, Greg. That's excellent. And when you see it actually in front of you, you can actually see how exceptionally well Dudley have performed in comparison to some of our neighbouring authorities. And I think certainly, we are extremely anxious about what is happening in Leicester, and also the fact that we've seen another report out today about that there are another 36, I believe, potential areas for a second wave, and two very, very close to us. So I think none of us can be complacent, and we've certainly got to re-emphasise the messages out there, to people to continue what they're doing to keep safe and keep well from this. So, Val, you come in on this.
Yes, Chair. If there's no questions for Greg, I just wanted to sort of to table the outbreak reports that were required by local authorities to support the very situation that you're talking about. So if there's no other questions, if Chair, if I can just sort of cover that item very briefly.
Yes, I've got nobody showing that they wish to speak at this stage. So over to you.
Okay. Okay, thank you. And I just want to say a big thank you to Greg and his team. They've been really on the ball in terms of making sure that we've been sort of translating data into our local situation reports. And it's been really helpful because we've been cited on any potential issues and obviously going forward, that data intelligence is becoming even more important to help us manage sort of situations at a much more sort of granular level. So I just wanted to quickly say that most of you will have had sight of the outbreak report, and because of the timing, it's not always been, as you can appreciate, aligning sort of reports being received by boards and meetings, because of the need to get some of these documents out based on national requirements. So there was a national mandate put in place that local outbreak plans were put in place to support the test and trace programme nationally, and 2 weeks ago we were asked to publish our outbreak plans, and so we to be published by the 1st of July. So they were published last night to meet that requirement, and I just wanted to sort of raise the fact that these are work in progress. We need to continue to build upon them, and what you've got that was shared with you is actually a public facing document, but behind that document there is a whole raft of operating procedures and policies, and a lot of work has actually gone into it from the wider partnership as well, but we are still awaiting different levels of guidance and support. So again, we need to continue to adapt our outbreak plan. And the other requirement was that we also put in place a governance structure. Again, that was sort of dictated to us by government in the sense that we have a COVID-19 Health Protection Board that would be chaired by the Director of Public Health, and that we would also have a member-led engagement board, and in most cases that's been sat under the Health and Wellbeing Board. So with agreement from partners from outside of this meeting, but partners linked to this meeting, we've had a meeting yesterday, and it's been chaired by Councillor Barlow as the chair of the Health and Wellbeing Board, and the purpose of the board really being to primarily lead on the communication and community engagement work stream, and it's about building public confidence and obviously helping us manage communication and engagement at a much more local ward base level as well. So the COVID-19 Health Protection Board has already met twice, and most of the organisations on the Health and Wellbeing Board will have members present on that, and they've been instrumental in helping shape the outbreak plan. The outbreak plan was assured last week by a regional convener that's been appointed by the Department of Health and Social Care, and I have to say we were given very positive feedback, and as was seen as an example of good practice and has been shared widely across the region alongside Sandwell's and Shropshire's, so I think that really sort of gave us a little bit of a boost in the sense that we are on the right tracks, and actually we and our outbreak plan is based on all of the positive work and all of the work that we've already currently done undertaken to manage the COVID in Dudley Borough. So I think that's all I wanted to sort of share, and for us to just table the fact that it has been published, and that we've had sight of it, and we will continue to update and build upon it as the situation progresses.
That's great. Thank you very much, Val, for that further update. Members, anybody wish to come in and make a comment? No, jolly good. So, Greg, Val, thank you very much. It's always reassuring to see numbers go in the right direction, and certainly, we just hope that this continues to do so, and that we don't have a spike. It's definitely the last thing that we want. So we just continue doing the excellent work that we are doing right across the board and getting those messages out to people about staying alert and washing those hands. So thank you very much. Matt, I've just had your message to say that you've got to dash off to another meeting. So thank you very much. I'll speak to you
Thank you, Chair.
Thank you. Right, we are moving on very well time-wise. Right, we are looking at how we move this board forward after this pandemic. So I'm going to hand over to Karen and Julia.
Thank you, Chair. Yes, we're going to do a bit of a double act. I'm going to start off and then Julie is going to do towards the end of the report. So just just to say that, yes, this is about sort of how we can reset the strategic purpose of the Health and Wellbeing Board as a result of COVID-19, looking forward into recovery and restoration. In terms of the report, some of the key points, first of all, just to remind ourselves that the system leader, the board, has a set of core duties that relate to the production of a process that gives us the joint strategic assessment and the joint health and wellbeing strategy, and that the board also is to enable and encourage integration across the system, engagement across the system, and to hold the system to account overall. Also, just to remind ourselves that the current health and wellbeing strategy has the 3 goals that you've heard about this morning, where we're going with those, but it also has 4 principles, and one of the key principles within that is about developing a new relationship with communities, one that focuses more on what agencies and communities can do together and what communities can do for themselves. So shifting that power base and working more as a partnership with our communities. Obviously, the Health and Wellbeing Board didn't have much of a role during the emergency phase, with it not being an operational group. But as we move into recovery, this is the time to sort of to revisit and look at what the contribution that the Health and Wellbeing Board can make going forward. And in order to do that, there needs to really, as we've alluded to already in a number of the discussions this afternoon, is to have a bit of a reassessment and review of the impact of COVID on the population's health overall, particularly to look at the positives and the lessons that can be learnt of how we've responded during the emergency period, and anecdotally there's a lot of really positive stories coming out about the way organisations have worked together, adapted, and etc. So we really want to try and build on that, and also obviously looking at what can be improved, perhaps what didn't work so well. Also going forward, as part of this process, the Health and Wellbeing Board will require some assurance, really, in terms of the local NHS reorganisation, to see sight of any changes in the local implementation or plans or structures as a result of COVID. And also, as Bal has already alluded to, the board requires assurance in relation to the public protection priorities, and that to some extent has been covered by the previous agenda item. Okay, so I'm just going to hand over to Julia now, who's going to pick up on emerging issues and asks and recommendations.
Thanks, Karen.
Thank you, Karen. I'm just going to skip very quickly through the emerging issues, because I think certainly in terms of the first item, the emerging health and wellbeing issues, we've covered in the reports that we've heard so far. Item 4.2 refers to the 3 current goals within the existing strategy, and I think generally it would appear that those are still just as relevant as before, but as we've heard earlier, we need to maybe shift our emphasis on those. People's lives and experiences have changed so much that we may need to reconfigure within those particular goals, but that the feeling at the moment is the goals would stay the same.
It's also highlighting the point that Karen's just made about the co-production community response that we were already engaging in before the crisis hit, and that we've seen some brilliant initiatives from communities and from the voluntary sector that we need to talk about, hear about, and learn from in terms of moving forward. Moving on, I'm going to focus more on the key asks of the board, because I think those are the things that we need to have a discussion about this afternoon. The first is that it's proposed that we carry out a review of the impact of COVID, and I think that's something that's already been flagged up several times today, and that this takes place across all parts of the system. The idea behind that would be to identify the impact and apply the learning that from the COVID crisis. So the proposal here is to set up a task and finish group that will lead with the production of a report. And as part of that process, the relevant partnership boards that are already in existence will contribute to that report. And that there's a suggestion that that should take about 6 months to complete. So that's the first recommendation. Leading on from that, the second one is a proposal that as part of that review, we set up one borough-wide conversation with individuals from communities, the voluntary sector and statutory organisation, using the approach that we had already started on before the crisis, to have some conversations and share our experiences and thoughts around what we can learn in the context of the 3 health and wellbeing strategy goals, but focusing on what went well and why, what do we want to continue with and what don't we want to continue with, and how do we do this together. I think that there have been already a lot of conversations about we need to talk to communities, we need to talk to each other, lots of ideas about what we can learn from the experiences we've just had. But I think what we're feeling is that maybe if we can combine all those into one big conversation, then we will get more out of it, and we'll save the risk, or reduce the risk of us reverting back to silo working, which is where we were some years ago. So that's the proposal for the one conversation. And prior to the COVID crisis, this board and the Health and Wellbeing Executive Group had considered on a number of occasions the role of the board and the role of the Forging the Future Strengthening Communities strand, because there were discussions about clarifying the 2 roles. And I think this approach helps us to gain some clarity over that. The recommendation is that the results of those conversations and the key recommendations and actions that come out of that should form part of the role of the Forging the Future Strengthening Communities strand. And then the Health and Wellbeing Board's role would be to hold the health and wellbeing system to account for its part in the responses emerging from that conversation. And in the context of that, the new Bishop of Dudley, Bishop Martin, in his capacity as aspirational lead for the Stronger Communities strand of Forging the Future, has offered to host that conversation and lead on that for us, if that's something that the Health and Wellbeing Board would feel was appropriate. So that's 5.2. Moving on then, there is a suggestion that the current emerging themes would reinforce the current strategy goals are still valid, and proposes that the system continues to deliver these goals but adapts to apply the impacts of COVID-19, something we've touched on already. It's also recommended that in the light of emerging evidence the impact on COVID-19 on the BAME communities, that we set up a subgroup to look at a system-wide approach to this issue. Also, that the findings and recommendations from the review that we're talking about are the focus of our annual Health and Wellbeing Board event next year. Health and Wellbeing Board and partner agencies are asked to consider how the local response to widening health inequalities can be advanced. Again, that was something we talked about earlier on. And then the last 2, there are 2 recommendations or asks of the board there, that the board receives an update on the government's arrangements, COVID-19 outbreak management plans and test and tracing programmes at the next meeting, and also an update on the integrated community provider establishment and progress. So those are it's quite a long list of asks, Chair, from this report, but they're designed really to pull together everything we've discussed so far in the meeting and look at a way of moving forward. I don't know if there are any questions at all.
Yes, Sally.
Chair, Julia, Karen, thank you very much. Hello, everybody. I just wanted to kind of add, Julia, to your reflections, particularly around the connectivity to the wider Forging a Future for All exec, who are doing a huge amount of work within the 7 aspiration themes as part of the reset and recovery phase. So your proposal there to link the community strand that Bishop Martin is leading, that people like Andy, Al, myself kind of actively involved with, makes a huge amount of sense, and I would fully support the recommendations you've made. Thank you.
Thank you. That's great. Thank you.
Thank you, Sally. No, I completely agree with her. I think, we've got to utilise this health and wellbeing board as much as possible. And I think that, it's an ideal time for us to do that. And this report certainly enables us to take stock of what's happened, what's gone well. I think there's been a significant amount, and how we can move forward and how we can sort of reshape our services moving beyond this in terms of more engagement with the voluntary sector and with communities, because they've proven, beyond a shadow of a doubt, that they can adapt to the situation. Kath, you've got your hand showing. And you're mute. Hello.
Double mute. It double mute sometimes. You take it off your mic and then you thing. It was just to seek a clarification, if I may. It's a really good report. So I just want to sort of make that point. In terms of the current strategy goals, are those the sort of the ones right at the beginning? Is it the ones that we've been working to? Am I missing something?
Yes, that's correct.
So it's the promoting healthy weight, reducing the impact of poverty, reducing loneliness and isolation. Is that what you mean? So we carry on with those goals.
Carry on with those, yes, that they're still relevant, and even more so. That was one of the recommendations.
Right. So I suppose one of the things, given the earlier conversation, and I think you did allude to this, the sort of the emerging concerns I am, and I'm sure Councillor Buttery and Councillor Ridley may have around children, and particularly emotional well-being and mental health of children, together with some of the loneliness, whether that can be strengthened in any way, because I think that's that hidden harm that I talked about earlier. And do we feel that those 3 priorities absolutely capture that? Because I think that's really going to be a challenge for children and young people going forward. And I'm just sort of putting it out there, does it feel as though it captures that as a real priority going forward does that make sense?
Yeah, I think Kath, thank you. Kath, I think to a certain extent, you're quite right that there is a whole raft of issues that we need to address for children and young people. That central strand of the loneliness and isolation one is particularly going to be very, very relevant to children and young people. And I think within the context of the review, we need to identify where there are issues that we need to look specifically at children and young people's experiences. And I think as well, the poverty issue, from what we've seen around the food poverty throughout this whole crisis, is a really big worry around children and young people. So there are elements within those 3, but I do see what you mean around the emotional health and wellbeing side of young people, whether that needs strengthening somewhere.
Thank you. That's really helpful. Thank you.
Thank
you, Chair.
Yeah, thank you. Thanks. Before I move on to one of our guests in the room, George, can I ask you to turn your camera off, please? If possible. I know you're on mute at the moment, but I've got your face showing on my screen. Just thank you very much. Thank you. Right, sorry about that. Councillor Ridney.
Yes, thank you. I would support what Kathy's saying. It is a matter of concern. At the moment, it's an unknown quantity because we won't know until we get back into our schools and into some sort of normality with our children, the impact that it will have had, this lockdown will have had on their emotional well-being and their mental health. With everything that we know, I think we are pretty sure that there is going to be a big impact, and I think the board needs to recognise that could well be something that in fact needs to take a focus in the coming months or the coming years, because as speakers have said earlier, the impact of this pandemic will actually influence what happens, not just for a few months, I think for a few years. But I am very concerned about the emotional well-being for our young people, both teenagers and our younger children, and the fact that I think a lot of children have understood, but when you are in households where you have adults with mental health problems, it's what understanding those children in those homes have felt, how they have felt supported. So I think this is going to be a big issue.
Yes, completely agree. I think, you know, we've got to make sure that we don't lose sight of our children and young people in this. Councillor Buttery, you've got your hand shown. I've got a couple of other comments that have just been brought to my attention. Prue.
Thank you, Chair. Yeah, again, just echoing, I think that the important thing we need to recognise is the children that we know about. So about sort of the 8 to 10% of children who are known who hit statutory services, whether they're looked after, child in need, child protection plan, youth justice system, whatever that is, early help. Those, we know where those children are, and the teams of work, I think Councillor Ridney will probably support me on this, and probably yourself with adults as well, Nick, that our council officers have worked phenomenally through this time, making sure our most vulnerable children and adults are safe through this crisis, and worked in, you know, ways that they, you know, you end up working from home with sort of 24 hours notice, you know, all our working patterns and work styles have completely changed. And, you know, the children that we know about, we know are safe because we know where those are, and we've been able to bring them into schools and put extra support around families, make sure that they have their free school meals, you know, and all that sort of thing. For me, and I think it's probably the same for Sue and Kath, it's what we're calling the known unknowns. So it's the next 10 to 20% that the school knows about, and between school and a youth club and a sports club and this kind of, we're keeping the kids on the right trajectory. They may not have a great home life, but, you know, because of all the interventions we're putting in, they don't meet statutory thresholds, but they've got, you know, we've got a really good chance to work with the connections teams around aspirations and about, you know, and they've done really well, to the point that actually before COVID we didn't have any NEETs in our year 12 cohort, which was a fantastic thing. So I think going back to previous conversations is that it's this group of young people that we're concerned about, and I know we've worked with Sally Bourne's team around the policing, that we've had young people in the parks, you know, particularly early on, we've put detached youth workers there to try and work out, well, why are you hanging around, what do you need to do, what can we do to support you? You know, obviously the obvious answer is to get them back into school, get them back into their youth clubs and get them back into their sports clubs, but, you know, as we do this, it's sort of assessing how are these children doing. So I want to make it very clear that the children that are known to us are safe in the borough. There's no, you know, big issue around that. It's the next group of children that may not hit statutory thresholds normally, and also it's going to affect children. You know, we were on another meeting, Kath and I, the other day, and we were talking about our aspirations around summer clubs, and somebody was saying, well, I'm not running a summer club just for some kids to go and play tennis for 6 weeks, you know. And it's like, actually, that would be a good thing. You know, mental health affects children from all backgrounds, whether they're affluent or deprived. And I think that's the thing with COVID and the impact of the children, leaving school so quickly, is we do not know what demographics are going to be affected the most. If children were very high aspirational, and perhaps from a very, a background where you'd see it as stable, but they really wanted to achieve very high and they put themselves under undue pressure, will we have an increase in suicides, or attempted suicides or mental health in that area? So I think it's a really, really complex pattern, and the usual sort of, not knowns, but the usual suspects, if you like, won't fit in these categories. So I think it's just something for the board to be aware of. Thank you, Chair.
No, thank you, Councillor Butty. No, I completely again take your point on board. I know that I see the Councillor Taylor's got a hand up, but just before I come in, Laura, I'm just going through some of the comments on the note page. And Marsha, you said that often healthcare and happy to constantly focus on children's mental health and well-being, and significant reduction in referrals to cancer. So thank you very much for that. Not sure what happened there.
I'm sorry, Chair, I couldn't hear that. Sorry, Chair, it went all blurry. I couldn't hear people.
It's right. There was a lot of feedback then from somebody. I think it's you, Kath. I've got a lot of feedback coming from you. No, all I was just going to say, Kath, is just acknowledging the comment that Marsha had put on the comments page. So I know that very much helpful. Councillor Taylor, Laura.
Thanks, Chair. It was just to pick up really on some of the comments that Councillor Buttery had made in terms of getting children back into sports clubs. I can't support her comments more because it's really important that we do get them back into these activities for mental health, for fitness, for loneliness and isolation. It covers everything. But what are we doing in terms of supporting these clubs to make sure that they can comply with some of the health and safety guidance that has been put in place? So some of the social distancing, for example. I mean, we've got a park near us that regularly has football clubs, and it's been really great to see them starting to pick up again. But when I've driven past, there has been a lot of disregard to the social distancing rules, and it just concerns me that some parents might be reluctant to send their children back if the social distancing isn't being complied with. So how are we supporting the clubs to make sure that the parents feel comfortable and confident to send their children?
I'm sure somebody can come in on that in a moment. Kath, do you want to come back in?
I was going to come back in on that for you, and I can only tell you from anecdotally, because I'm involved in a local cricket club, and we have to follow the ECB guidance. So they started the cricket practice training, and there's very strict guidance that follows the government, and the football associations, your rugby associations should be also, I would anticipate. So we need to be checking whether they are following the guidance. We've had to do risk assessments, we've had to put in all the different measures in line with the ECB guidance and Sport England guidance. So I know that anecdotally, Chair, from some sort of volunteer work that I do, but I would imagine, Councillor Taylor, that would apply to your football associations, which most of these clubs are usually linked to, and rugby associations and tennis associations. So, but how that links to people that just run a club that's not linked to the bigger organisations, I don't know. But I just wanted to share that as a bit of anecdotal information, Chair.
No, so you take that on board. Thank you very much. Sue, do you want to come in?
Yes, just coming on that point, Chair. I know that a lot of information has been published on the website around businesses and other organisations opening back up and the COVID-19 advice and risk assessment, and also a lot of work has been going on through the test and trace subgroup. So I just wonder, Bal, if that's something that public health could pick up I know you've got a lot on your plate at the moment, but just in terms of our local sports and leisure facilities, just ensuring that they're cited on the risk assessment and other guidance. I'm not sure which group that would neatly fit into. I know there's one around businesses, but I just wondered if that's something that could be picked up through that work stream.
Through the chair, yes, Sue, yes, we can have a look at that and support that.
I think as well, I know that we've got Active Black Country as well, which it all feeds into that. So I'm sure that they have been providing a lot of support out there as well. So has anybody else got any other comments that they wish to make? Certainly, mental health is a huge topic at the moment and is affecting everybody in some shape or form. And so I think we've got to look at it right across the board. So I'm sure that Karen and Julia will take on the points that have been raised so far. I think another area that we need to look at in terms of health and inequalities and certainly in terms of isolation is our homeless people as well, and the support that we've given them, and also that we need to continue to do moving that. So again, that's another area that we need to have a look at. Julia, you want to come back in?
Yes, Chair, thank you. It was just I was just looking at the chats, and I just wanted to reassure Neil that when we were talking about the findings being shared in an event in 2021, we did sort of think that would be a culmination of a process that we'd gone through. So we would anticipate reporting back to the board much more regularly than that. I just wanted to reassure Neil that we weren't going to leave it for another year before we reported back on that review. So we would hope that we will have something at the next meeting to report back on.
Yeah, no, absolutely. Thank you for that, Julia. Right, so I think we've got a lot of support for that. So we'll we'll move on at a pace. With taking stock and having a look at how we need to move the goalpost. Excuse the pun on sport. So thank you very much for that. A good report. It's back to Karen and Sue now for the violence prevention strategy.
Thanks. Sue's going to pick this up.
Thank you. Yeah, thanks, Chair, and thank you, Karen. Please chip in, Karen, if there's something I forget. Thank you. So over the last 12 months, Karen, I have been updating the board around the development of the violence prevention strategy, and we have virtually tabled at tonight's meeting the near final version of the strategy. So we are asking our board to ratify the strategy subject to any amendments tonight, and I have got a couple of amendments which I'll update on as I go through the board. So as we've said all along, addressing violence is not a single agency issue, as it's a culmination of many different issues, but we do need a strategic, coordinated approach that involves a range of stakeholders to effectively address the issues around violence and violence prevention. The strategy that we've produced will be an overarching framework that picks up a number of strands of work, and we will be developing an action plan. People have told us overwhelmingly that feeling safe and living without fear of violence underpins being able to live a good life and to thrive, and that's why, in terms of the vision for the borough and the strategy, partners and community have come up with a vision around Dudley's a safe place, and together we want to make it safer. In terms of taking the strategy forward, we've identified, again through consultation, 3 goals really. So goal 1 is around embedding and scaling up our universal prevention programmes, such as nurture-based programmes, street watches, community resilience and good quality physical environments. In respect of our second goal, it's around taking a whole system approach to focus on our high impact areas, which are Brierley Hill and Dudley, and I'll say a bit more about those in a moment. And obviously that's key to addressing some of the issues that we have in the borough. And then in terms of our goal 3, it's about scaling up and testing approaches where people have already been drawn into violence. So we know, for example, through the criminal justice system, some programmes are offered, for example, to those on court orders. And where we've got the evidence to say they work, it is looking at, well, can we scale those programmes up for people that may not yet have been before the court but could be heading in that direction. So those are the 3 overarching goals. In terms of the strategy itself, in respect of page 37 that forms part of the board report, we've highlighted the impact of violence and the risk factors. Page 38 is sort of Dudley in numbers, so from the evidence that we've pulled together, it's sort of an overview of what the situation is looking like in Dudley. The impact areas, which are Brierley Hill and Dudley Central, again, information is provided on page 39 of the report. And it's our intention to have a focus in those areas as well as looking at issues borough-wide. Page 40, we've summarised what the community have said, and that was quite powerful, as it always is, through the World Cafes, through work with children, through work during Play Week last year, and through the online surveys. So we do really thank the community for their contribution. And as I say, page 41, we're looking at what our approach would be through those goals. We have had a couple of amendments already tabled for the report, for the strategy, and those amendments are in respect of got sort of our 3rd goal is scaling up the work around domestic violence and abuse, and then in respect of work, universal work, which we've called scale 1, is around linking in with the Forging a Future for All and the Borough Vision there. So that's just a quick overview of the strategy and of the report itself. We will be working to produce an action plan very shortly. There is already a plan in place through the neighbourhood policing unit, which we call a 4P plan. So around protect, prevent, prepare and pursue. So we won't be looking to duplicate actions that are already in that plan, but we'll look at what we need to drive outside of that plan in terms of preventing and reducing violence in the borough. So Karen, I don't know if there's anything else that you want to add that I may not have covered in that quick whistle stop tour.
No, I think that was an excellent overview. Thanks, Sue.
Yes, thanks very much, Sue. No, very comprehensive, and the report that's appended to the document, I think it's very it's colourful and it's very concise, and that's what those are the sort of things that we need to get the messages out there. Again, with the current coronavirus situation, I think we are mindful that people are in lockdown in sometimes some very tense situations. So again, I think it'd be interesting to the stats that we eventually receive around domestic violence, and whether there has been an increase in cases, and also there is also the possible fear that some people are unable to report cases. So again, I think we have to try and get those messages out. I can certainly continue to get those messages out to people, but they should not be living in those situations by any means. So has anybody got any comments that they wish to come in with that? Oh, Sally.
Thank you. To bring from me, if I may, first of all, huge thanks to Sue and Karen, who have worked so incredibly hard in putting all of this together, working closely with a wide range of partners on this over the last 12 months. It does really feel like a significant moment in signing this off today. Whilst a lot of this work has already been taking place, what it provides us as a borough is a really clear foundation, a consistent platform, a level of coherence to really drive this forward together as a priority. So that was just my observations, Chair. Thank you.
No, thank you, Sally. That's much appreciated. No, it is an excellent report, and again, it's great partnership working with you, Sally, and with your colleagues. So no, that's really really good. Sue.
Yeah, could I just come in, Chair, on a point that you made earlier around lockdown and the impact and domestic violence and abuse? Through the Safeguarding Partnership, there has been a weekly focus on domestic violence and abuse and the numbers. Yeah. And certainly we have done a lot of comms work, and also we've looked at how we could perhaps reach people that are not going out. So, for example, we've produced postcards to go in food parcels and smaller business cards to go in some prescription bags, and our provider that provides a single point of contact for Dudley, and they've got a WhatsApp number, so if people aren't able to ring in, they can message our single point of contact. So we are conscious of the impact of coronavirus, and people may not be able to get out and about, so we are looking at ways to be as creative as we can with our providers and other partners around that situation.
Thanks, Jane. I'm glad you've highlighted that, because yes, I know that you and Safeguarding have done a lot of work, to really push this forward. So thanks very much. Thanks for highlighting that. So members are happy to receive that report. So we are doing very well for time. One good thing about on these team meetings is if they're quite a pace. We are reaching the end. So moving on to item 12, that's the date of future meetings, which are in front of you. And we are to deal with future doing these in victorious technicolor on the Teams. It seems to have worked reasonably well this afternoon. I haven't put anybody off. Yes, we do it all again in September. So lastly, usual question to consider any questions from members to the chair with 2 clear days notice has been given to the monitoring officer as per Council Procedure Rule 11.8.
None, Chair.
I'm glad to hear it. Just before I close, I just really want to say a huge thanks and place on record a huge thanks to everybody in this room for the work that you have done through this pandemic and continue to do so. I think this has been a huge team effort right across our and really your staff, volunteers, everybody. So huge thanks from me, and we will see you again this evening. Thank you. Please go.
Thank you.
Thank you. Bye.
Thank you.
Thank you. Thanks,
Chair.
Chair.
Bye.
Bye-bye.
Bye.